For more on this, let's bring in Malcolm Mulholland from Patient Voice Aotearoa. Malcolm, thanks so much for joining us tonight. What are we talking about when we say elective surgeries? So why is that so important that those surgeries happen sooner rather than later?
Elective surgeries are very important because if left untreated, they can develop into, in some situations, life-threatening scenarios. So just take, for example, a hernia that you might be waiting to be operated on. If that's left untreated, that can lead to strangulation of the surrounding tissue, which can result in blood supply being cut off and that tissue beginning to die. If, for example, you have, say, kidney stones, that can result in a loss of kidney function. Or if you have an appendix, that can result in a leak of bacteria into your belly. So with elective surgeries, it's really important that it is acted on sooner rather than later.
Now, surgeons say that the problems run deeper than just the pressures of COVID and the winter illness having on the system here. Is that the case as you see it?
Yeah, absolutely. We've been hearing for some time now, even in the early days of COVID, that date pre-COVID, that patients were having to wait an extraordinarily long time to have elective surgery. And certainly the more that you talk to the workforce, the more that you hear that this is a long-standing issue, one that existed well and truly before COVID ever arrived on our shores. So I think there needs to be some acknowledgement by the government that this is a long-standing issue and that they have a plan by which to address it.
What do you think should be in that plan?
I'd like to see some creativity. I would like to see some engagement with the private sector, for example. It would seem that they have a workforce that's there ready to go that just needs to be engaged with. But I also think we need to start thinking outside the box. And that could mean either flying surgeons and nurses and clinicians in to conduct surgeries in New Zealand, or potentially flying patients out so that they can get the treatment. Otherwise, this is actually going to cost us more in the long term.
Something else that could cost us more, the backlog of screening and management of cancers and other illnesses sort of bubbling away at the primary care level. How worried are you about that, just quickly?
Yeah, very, very worried. The longer you leave it in terms of being diagnosed, the worse the result tends to be. And so that's what they're currently experiencing over in Australia, that people are presenting in a later stage of cancer, and that's extremely worrying and needs to be addressed urgently.
Okay, Malcolm, thanks very much for your time tonight.
Thank you.